Good morning and welcome to the Thursday, September 17th COVID-19 briefing. I'm Megan Pearson, your Chief Communications Officer, and today I have with us our Chief Administrative Officer, Ryan Alsop, our Director of Public Health, Matt Constantine, and our lead epidemiologist, Kim Hernandez. First, I'm going to turn it over to Matt for his updates.
Good morning. This morning we are reporting 72 new COVID-19 cases in Kern County residents and no additional deaths. I want to talk briefly about the state's new monitoring program. We've spoken about this somewhat earlier, but just to review, the state made changes so that now we have 4 different tiers with corresponding colors. The state is measuring case rate and percent positivity to determine how the counties, and in particular Kern County, is doing in our efforts to battle COVID-19. The case rate is the average number of new daily cases averaged over 7 days with a 7-day lag, and percent positivity is averaged over 7 days with a 7-day lag. The case rate, in order for us to meet the red tier, tier 2, or for us to move down a tier so that we can open up additional businesses and potentially schools, the red tier, we have to be below a case rate of 7. Our unadjusted case rate as of Tuesday is 6.7. So that's good. We're below the case rate, and that puts us, at least initially, in the red tier. The testing positivity needs to be below 8%, and it is 7.1% as of Tuesday. As we've spoken before, however, the state is now looking at the number of tests that we perform on a daily basis, and then we are compared against the state average. Because the state has indicated that our average testing rate is lower than the state average testing rate, they are artificially augmenting our case rate and increasing it from 6.7 to 7.5. That puts us back into the purple tier. The state runs these numbers every Tuesday and publishes it on their website, and we obviously track that very closely. In order for us to progress to the red tier, we have to meet that criteria for 14 consecutive days. At such time, then, we can progress into tier 2, or the red tier. The state has also made mention of an additional metric, the health equity metric. This is still in draft form. We've had a couple discussions with the state about this new metric. This metric is going to compare census tracts within the county and compare census tracts that have a high testing positivity to those that have a low testing positivity. And the state is going to mandate that we make improvements going forward so that we try to address that high positivity rate in some census tracts and bring that rate down. This is still in draft form. They have not released the document publicly yet, but from what we understand, once it's released, we will have 6 weeks to make a 10% reduction in that difference in order for us to progress within tiers. So there'll be more details coming out about the specifics on this. The summary is the state is asking us to look throughout the county for areas that have higher rates of testing positivity and to try to address that by throwing additional resources in those communities to try to bring that down. And within 6 weeks, we need to show improvement to allow us to continue to progress through the tiers. With that, I'm going to turn it over to Ryan. Thank you.
Good morning. I appreciate that, Matt. Before I get started with COVID, a little non-traditional, we don't really talk about things unrelated to COVID at these press conferences, but I'm going to make an exception to talk about Kenneth Twisselman. On Monday, Kern County lost a local ranching legend and cattle industry giant, Kenneth Twisselman, the real deal. Mr. Twisselman was not just a cattleman. He was a farmer, respected businessman, longtime school board member, and patron of the arts. He was a kind, generous, and humble man, and he'll be remembered for his contributions to our community, his leadership in the cattle industry, and really what makes Kern County so special and unique. And we send our best wishes to Mr. Twisselman's family, and particularly his wife of 68 years, Rosemary. Now on to COVID. Today, we've tested 184,000 people in our community to date, 31,148 positive tests to date. Of those who've tested positive to date, 30,666, or 98%, have either fully recovered or are presumed recovered, or are isolating and recovering at home, treating their symptoms on their own. Today we have 142 people receiving some form of care in area hospitals. A few comments on the Board of Supervisors. This past Tuesday, there were a number of things taken up by the board, actions related to COVID-19. Tuesday, the board used or approved the use of $1 million in federal CARES Act funding for a program called the Housing to Harvest program. They also authorized in that same agenda item an agreement with the Community Action Partnership of Kern, or CAPK, to serve as our local administrator for this program. The program's designed to provide temporary hotel options, housing options for essential farm and food processing workers who are either COVID-19 positive and are not requiring a stay in an area hospital, or who were exposed to the virus. The program provides safe and suitable places to isolate to mitigate the spread of COVID-19 among these workers, their households, and our community overall. The program falls in line with the governor's blueprint for a safer economy to identify a plan for potential risk areas in an effort to reduce case transmission, reduce overall testing positivity rates, and allow the county to move more quickly to advance to a lower tier in this blueprint that has been provided by the governor, allowing increased business and school reopening. Importantly, this program will provide additional outreach to these workers as well as testing. The Board of Supervisors also on Tuesday approved an MOU with the City of Bakersfield, which allocates additional funding to the Kern Recovers program. The City of Bakersfield is providing an additional $3 million in forgivable loan assistance for small businesses located within the Bakersfield city limits, and an additional $2 million in grant funding to nonprofits that are located in the Bakersfield metro area. I want to thank the City of Bakersfield and their leadership for providing this additional funding. It's meaningful, value added, and it is appreciated, I know, by area small businesses, and we are honored to partner with them to make this happen. We urge small businesses interested in financial assistance, if you've not already been given that financial assistance by the county, if you are in the Bakersfield city limits, you can go to kerncounty.com to apply, see details on this program, and apply for some assistance. Same with nonprofits. If you are a nonprofit anywhere in Kern County, we have financial assistance through a grant program available to you now. We encourage, if you are a nonprofit, please visit kerncounty.com to see details on how you may apply and receive a grant. Also Tuesday, the board made a referral to my office to bring back a resolution that they will consider sending to California Governor Gavin Newsom, demanding greater clarity, consistency, and continuity in his directives to our county, our business community, and our residents related to COVID-19. This resolution has been drafted, and the board will consider it next Tuesday, September 22nd. The catalyst for the board's referral to my office on this resolution is the governor's recently announced blueprint for a safer economy and changes that have been made subsequent to the announcement of that blueprint, which was made on August 28th. This blueprint originally and specifically required California's counties to meet stated and simple benchmarks in overall case rates and testing positivity rates in order to move into less restrictive tiers that would allow for a measured reopening of businesses, schools, and other activities in our community. On Monday, September 7th, Governor Newsom announced an adjustment to his blueprint, now including a benchmark on overall testing rates as an added criteria California counties must meet for the measured reopening of businesses, schools, and other activities. At issue here, Governor Newsom is now arbitrarily inflating overall case rate numbers in those counties who have an overall testing rate below the statewide average, further slowing and complicating a county's move into a less restrictive tier. This statewide testing rate average is a moving target and is not based on any clinically relevant data or information. This new criteria unnecessarily burdens our residents, parents, and children, further slowing business and school reopening, and it unnecessarily and arbitrarily penalizes counties who have little to no control over voluntary and individual decision-making related to testing for COVID-19. Governor Newsom's emphasis on increasing overall testing rates and the new benchmark on overall testing rates he's ordering California counties to now meet in order to allow businesses and schools to reopen also seem to conflict with Center for Disease Control directives on testing. Demonstrative of these new requirements on testing rates and their direct tie to when and how businesses, schools, and other activities in our community may open more widely, on Tuesday, the Board of Supervisors unanimously approved an emergency item brought forward by my office that encourages county employees to get tested multiple times between now and the end of the year voluntarily. The governor is now requiring overall testing rates as a condition for businesses to reopen, then we will adapt and do everything that we can as an employer to help our county get into less restrictive tiers of his blueprint. We have some ability to do this with our own employees, much less of an ability to do this everywhere else, which is a source of, has been a source of our frustration here. Lastly, I want to make a couple of comments about some information that we just learned about that is equally frustrating, if not more, for us. There are 8,600 tests that are not being counted by the state and not being included in our county's overall testing numbers by the state. These tests are associated with the federal testing site that has been in Kern County. As you're aware, it was at the fairgrounds for some weeks. We have that once they left the fairgrounds, this federal testing site became a mobile testing site where it is being moved around the county to make sure that we are testing as many people as possible. In fact, we have been out at Edwards Air Force Base for the last 2 weeks testing personnel on that base. And we'll be using this federal testing site going forward in an effort to meet the governor's new requirements on testing. We need to have assurances and confidence in the fact that the state is accurately reflecting our community's hard work on testing. We do not have that confidence today. The 8,600 tests that are not being included, that were done by our federal partners, is frankly unacceptable. These thousands of tests being done in our community by our federal partners, they're not being counted. And it's mind-boggling that the governor's own people who are involved in supporting and promoting these testing sites, this federal testing site, it's mind-boggling that they're involved in the way that they are, yet those numbers are not being reflected accurately in data being published by the California Department of Public Health. Governor, we're asking you, we are strongly urging you to intervene and fix this problem immediately so that the testing that we are doing locally is accurately reflected in the data that you're collecting. This is important because you are holding us accountable to increase overall testing rates in our community. And you are tying those overall testing rate numbers to how we're able to move through your blueprint so that we can open in a measured, safe, and responsible way more businesses, our schools, and other activities. So we're planning on working with the governor and his staff in the hours and days ahead to make sure this problem is addressed. It's important that it gets addressed because we will be using this mobile testing site in this community for weeks to come. We'll be moving it around, strategically positioning it to maximize optimize people's ability to go and get tested in an easy way, so that it's done easily. Testing rates are important, Governor. You have stated that. That is part of your blueprint. Please intervene and fix this problem so that, that we can have assurances that these numbers are being counted accurately. With that, I will hand it back to Megan for questions.
Thank you, Ryan. Okay, as we typically do, we're going to go down our list that was shared with the media outlets. Remember, it is *6 to unmute. And a quick reminder as well that we ask each outlet to ask their initial question and that we will come back at the end for second and follow-up questions. So if you could limit it in the beginning, that's helpful to your other media partners who have other assignments to get to. So starting at the top of the list based on who is dialed in, we have Austin with Channel 23. Do you have any questions?
Yeah, hi there, guys. Thanks. Wondering if there could be some clarification on why the state is not including those numbers from the federal testing site as far as the metrics for Kern locally.
Thanks, Austin. We're going to have Kim Hernandez, our lead epidemiologist, respond to your question.
Good morning, Austin. Thank you for your question. So what happens in the process where the state is counting the number of tests that are coming through is that they are counting all of the ones that are submitted to us electronically. The federal testing site, the surge site, is still submitting everything manually, so they are sending us faxed reports of all of them, and so they get entered into the system because they're not automatic, the state has not been counting them at this time. We're continuing to work with them to get those set up so that it will come through the expected process of coming through electronically and that it can be then counted up by the state.
Thank you, Kimberly.
Okay, our next outlet that we have dialed in is the Mojave Desert News. I believe we have Jack on the line. Do you have any questions? Okay, we'll go to the next outlet. I'm just going to check and see if we have Mountain Enterprise on the line. Our next outlet is Valley Public Radio. I believe we have Carrie on the line.
Hi, thank you. Yes, I wanted to follow up on that with Kim, just on these tests. So these are not So they're entered manually, but presumably they still go into an electronic system, right? So is it just that it's the wrong kind of system? I guess if you could still offer some more clarity on, I mean, obviously I know that this is maybe you don't understand everything happening at the governor's level. You obviously don't agree with it, but yeah, just a little more clarity on why that would matter.
We'll have Kim respond. Thanks, Carrie.
Hi, Carrie, thanks. The state has to go through every test in the state of California. And so the electronic process, when things are submitted electronically, it allows it to have a uniform process. There are some things called HL7 messaging that our labs use so that everything comes through in the same way with the same values and elements, so that when they're doing all of that data processing at the state level, that they don't have to go and pick through each individual record to make sure that it fits the criteria it's supposed to. So the electronic lab reporting is something it makes it a little bit more efficient for them to be able to assess all of these numbers quickly for us so that they can report it. And so currently, when it's entered in manually, it gets into that CalReady system that we talk about. It gets to us at Public Health so we can investigate it. But because it's all entered manually and it's subject to things like the typos and sort of inconsistency that doesn't fit the same boxes that the electronic laboratory reports come through, it doesn't currently get counted in the state's process for evaluating all of those metrics.
Okay, thank you.
Hi, I wanted to follow up with on what Kim said. This is why people really like government. What we're asking, I don't think the governor knows about this, to be fair. We want him to know about it, and we want him to do something about it. We want it fixed. This is completely unacceptable. It is unfair to our residents, our businesses, our schools, the way that overall testing rates are now being calculated. It's unfair to all of the people working so hard on our staff here at the county, the people from the EOC that are managing testing sites. It's unfair to the state OES employees who are managing. It's unfair to the federal employees who are here doing all this work. This needs to get fixed. I believe it's an easy fix, and we are asking the governor to look into it, engage with his staff, and to order that this get fixed immediately, given the importance being placed on testing.
Our next outlet is Channel 29. I believe we have Emily Irwin on the line.
Hi, so I was wondering, so some people in the community and even some schools have sent communication home that they have optimism that the county might be able to move into the red tier as soon as the next 2 weeks. But with this new health equity metric, I don't know if that's possible. I'm wondering where public health stands on that and what their estimate is for when we might be able to move out of this most restrictive tier.
I think Ryan's going to respond to your question, Emily.
Great.
Thanks for the question, Emily. We'll say that we are optimistic. We're working very hard. Our numbers are going down. We're flattening the curve, and our case rate, overall case rate, and overall testing positivity rate numbers are going down. We are faced with this adjustment that is being made on case rate due to tied into our overall testing rate. I know this is complicated, but we're on a good track. We're working hard, and we are optimistic. And I think that the community should be optimistic too, and I think that it should be a sign that what it is that they are doing to help manage the spread, slow the spread, flatten the curve is working. All the public health best practices that individuals, businesses, people in this community are practicing are having an impact. We don't have a date on any of this, when we think we'll move into the next tier. But to answer your question, we are pleased with our progress. we're pleased with where we are, and we are working very, very hard to move this county, as demonstrated by the things that were said here today, working very hard to get us into a position to move into the red tier. I will say, with regard to the various changes that have been made subsequent to the governor's announcement of his plan on the 28th, there have been several changes over the last couple of weeks. The overall requirement on testing rate, which we talked about, which is at issue with this data glitch that's happening between the federal lab and the state public health group. The testing rate is a much more challenging criteria for us to meet. This is, requiring, in order to get to the state average, we're talking about 600 to 700 additional tests that need to be done every day in a sustained way going forward. It's a much more challenging metric, which is why we're spending so much time on it. It is the number one issue that we have with the governor's recent changes, and that's where we're going to continue to keep our focus.
Our next outlet is Channel 17. I believe we have Aton on the line.
Yes, good morning, everybody. And it's on that last note that Ryan was talking about that brings me to my question. On Tuesday, Matt Constantine said 607 tests per day would be needed in order for the state to stop artificially inflating the numbers. So with this latest announcement from Ryan just now about the 8,600 tests that are not being approved, not being counted by the state, if they do count the 8,600 tests, then as far as you know, will we not need to do 607 more tests every day?
Thanks for the question, Aton. We're going to have Kim respond, and I think, we'll have Kim respond.
Good morning. So we are going to continue to work to get those older cases into the system electronically, but all of the metrics that come from the state move forward. And so even when those get plugged back in, they're not going to go back and say 3 weeks ago, this was your old case rate. So we are trying to work on it now so that for the next assessment, it will be included in their calculations because we want to make sure that it is accurately reflecting what's going on in our community. So it's something where it's moving forward is what, where the correction will help us. We don't think there's any way for them to take the information that gets backfilled and to adjust any stuff in the past, because we're moving on to where are we now and where can we be in the next few weeks.
All right, thank you.
Our next outlet is KUZZ. I believe we have Rob King on the line.
Yeah, hi, Megan. My question is there a plan in place or a strategy being discussed in order to get more regular residents of Kern County in to get tested?
We'll have Ryan respond, Rob.
Yes, there is. You saw part of that plan exercised and implemented at the Board of Supervisors meeting Tuesday. Obviously, the county has, we're the largest workforce here in this region, over 8,000 employees. We're making sure that we get our own house in order and are encouraging as many of our employees voluntarily to go and get tested. We believe that could have a significant impact on our testing rates. We're encouraging other local governments across Kern County, school districts, cities, to consider taking similar actions. Obviously, to Matt's point, in communities that are at high risk, in disadvantaged areas, groups like our task force that was put together to help us navigate through and address issues in our Latino community. That is going to, I think, bear fruit and play a significant role in increasing testing there. Obviously, our Housing to Harvest program is, part of that. There's testing involved with that in isolating up to just under 600 individuals through this program. There are a number of things we'll be doing, obviously communication-wise. In terms of if you get away from testing and you want to talk about getting positivity rates down, not only overall, but in certain high-risk areas and communities in our county. We've distributed thousands, tens of thousands of free PPE through our distribution program, Kern Recovers. We're utilizing CAP-K to get masks and gloves and sanitizing equipment and things into the hands of people that may not have the ability to get that or afford it. That program has been quite successful. It's not just going to disadvantaged individuals and communities, in the form of masks, gloves, et cetera, but we are also providing thousands and thousands and thousands of this equipment to our small business community across a number of different industries. At last count, I think we were impacting about 50,000 employees of those businesses who have taken part in the program. So yes, we are not only exercising today toward focusing on getting testing rates up, but we'll be planning in the days and weeks ahead on how we might be able to do that better. Keep in mind, this is a voluntary action, individual action. We cannot force people to go get tests. We can only convey to folks that the governor is now holding our businesses and our schools and all of the reopening and the activities from just a measured reopening, not a full reopening, but a measured reopening through tiers. He is holding us accountable for overall testing rates. And so if you would like to be helpful in getting us moving through these tiers at a quicker pace, then we would ask you to go get tested at any number of the testing sites that we have here throughout Kern County. And all of that information can be found online at kerncounty.com.
Okay, thank you.
Our last outlet is the Bakersfield, California, and I believe we have Sam Morgan on the line.
Yes, Megan, hello. My question just has to do with the low numbers of tests that are taking place in Kern County. Obviously, the announcements every day from the Public Health Department have shown that fewer people are coming back with positive tests for coronavirus. And I'm wondering, with the lower amount of tests that people are getting in the community, does that mean that we could be missing some cases out there and that there could be more people that have coronavirus that we just don't know about? And does that put people at a greater risk for getting it compared to back when we were getting like hundreds and hundreds every day that were coming back with positive results?
Thanks for the question, Sam. Let me just make sure I understand what your question is so we can pass it off. You're asking if the lower number of tests being performed now is actually putting us at a greater risk for not catching those positive COVID patients?
Yeah, that's essentially it.
Okay. We'll have Kim respond.
Hi, Sam. So We are seeing fewer cases in our community. We're seeing this throughout the state of California, that in many counties, the case rate is going down. We are hopeful that this is a true representation of what's in our community. We do continue to encourage people who have symptoms to contact their healthcare provider and to be assessed about whether or not they need testing. We know that the testing volume tends to reflect, and the case rate tends to reflect what's going on and the perception people have, and we are hopeful that we are still able to get all of the people who need testing tested. We have testing capacity, and that's sort of a very important piece to make sure that it is widely available in our community, and that it is accessible to people in our community, so that they can go and get tested if they feel the need. If they've talked to their healthcare provider, or if they are having symptoms that might be COVID, if they have concerns about being in close contact with someone, if they have concerns after traveling. And so we are hopeful that it is reflective of what's truly in our community. We know that there is always some risk of missing people here and there, and those few people, if they don't get tested and they don't know that they're positive and they don't isolate at home, can transmit to other people. So we want to make sure that our community knows that it is widely available. They can go online to the county website to look for the testing sites. They can contact their healthcare providers. A number of our healthcare providers are testing on-site at their offices, and so we are hopeful that we continue to encourage people, if they have concerns about COVID-19, to reach out to get tested so we can evaluate their situation, and that if they are indeed positive, they'll know that they need to stay home, that they can talk to us at Public Health so we can help identify any others who might have been exposed, so those people can stay home and quarantine, so that we can limit transmission in our community. If we continue to do those things, we hope to continue to see the case rate go down, because we hope to be interrupting transmission in our community, so we don't spread it any further.
Thank you, Kim. Okay, I'm going to go through the outlets one more time just to make sure we catch any follow-up questions. Back up at the top, Channel 23. Austin, any follow-up?
Hi there. Yeah. The new census tract metric that you guys were talking about, is this another potential setback for the county?
Thanks, Austin. We're going to have Matt respond. Give us 1 second.
Okay.
Austin, good morning. The health equity metric that the state has yet to release does add another component to our efforts, but really the main focus here is the number of people that we can test to try to remove that case adjustment. We'll yet to kind of see what the health equity metric does. Once implemented, there'll be a 6-week delay, it sounds like. They're still refining it based on comments. So right now, our focus is on meeting those current metrics, getting our testing positivity down, getting our number of tests up, and getting the number of the case rates down. So that's really what's driving all of our efforts so that we can then try to get our businesses and schools back open. Does that answer your question, Austin?
Yes, it does. Thanks, Matt. I had another follow-up from last week. There was some frustration, obviously, last week toward the state regarding the artificial increase of Kern's case rate. Mr. Alsop had requested that the state reconsider the artificial increase. Again, it looks like you guys are asking for that again this week. I was just wondering if you've heard anything back from the state regarding those requests so far.
Austin, no, we have not heard anything back. We know that other counties have similar concerns. The state calls that I'm on, the health officers and health directors express similar concerns, but we have had no proposed changes in the metrics that the state's using.
Thank you. Many business owners are obviously frustrated with the economic restrictions that are being imposed by the state. I was wondering if a large amount of businesses were to decide that they wanted to open up anyway, we've seen a couple already do that, and they were to choose to ignore the state's framework, what kind of enforcement could they face?
Yeah, so Austin, we've addressed this question on a number of occasions. It's an important question, of course, but the state has enforcement authority. They have ties to many of these businesses. They issue permits. They do inspections. They have a enforcement team that's active throughout the state. We do get now weekly updates about their activity in counties. So they face potential enforcement from the state. Our approach, of course, is we want to do everything possible to keep those numbers down so that we can get everybody back opened appropriately so. So there's, again, a lot of work that's being done. The Board of Supervisors has been very active in trying to find ways to improve those metrics. And we know together we're going to get there. You heard the Surgeon General even express a good amount of optimism about where we are going and where we've been. So we're hopeful with continued effort, not to let up, more effort, that we're going to get there and we'll meet those new tiers and allow more businesses to open. Hopefully that addresses your questions, Austin.
Appreciate that. Just one last thing, because we've been asking last couple of weeks, if there's any update on whether or not you guys might be able to release the ages of people that have died from COVID here locally.
Austin, they're still working on it, and they're not able to release that data yet.
Okay, thanks, guys.
Okay, our next outlet, Jack with Mojave Desert News. Did you have any follow-up questions? Carrie with Valley Public Radio, any follow-up?
Yes, I do have one. So earlier on, and you've sort of addressed this indirectly, but earlier on when case rates were much, much higher all across the board, we were really, our public health officials in general were really discouraging people from getting tested unless they had symptoms or had no exposure, just because there was a shortage of so many tests and things. So, and the governor himself also, was saying this. So do I understand now that really it feels like, especially in the case of Kern County where the testing rates are low, does it really feel like we're now incentivizing healthy people, or the governor is incentivizing healthy people to go out and get tested?
Carrie, sorry, we're trying to figure out who's best positioned to answer your question. Let me make sure I've got that right. What you're asking is, at one point, there were some officials that had said they were encouraging only those who were symptomatic to get tested. In fact, I think there were guidelines that were put out for labs at one point. I think that's what you're getting at. However, now it looks like there's an incentive for those who are asymptomatic to get tested as well. Am I summarizing correctly?
Yes. Yes.
Okay. Sorry for that. We're going to have Kim Hernandez answer your question.
Hi, Carrie. Yes, you're correct. When there was a lot of COVID-19 spread going on in the community throughout the state of California, and we were seeing some significant testing delays, and there were some concerns about getting test results back quickly. We spoke a lot about ensuring that people who are symptomatic could get tested. And so as the number of people out there have gone down and we have increased testing capacity, the turnaround times have improved back to what they were before that surge in cases in July. We're seeing wide availability in our community. We have always recommended that anybody who has a concern about COVID-19 be tested. So if they are symptomatic, if they are concerned about an exposure, we know there's a lot of anxiety around potential exposures, and that testing can help bring some of those close contacts peace of mind while they continue their quarantine and they watch for symptoms. And so we continue to encourage anybody who has concerns around COVID-19 to contact their healthcare provider. They can call us at the health department to discuss their situation, so we can help address that. And that if they have concerns, testing is something that is widely available in our community now and may be recommended depending on what they discuss with their healthcare provider.
Okay, so you can't speak to whether this change in policy and kind of this inflation or punishment of the testing rates, whether that have kind of changed the incentives for people or for county health officials to go and encourage people to get tested.
Carrie, we're going to have Ryan respond.
Carrie, you're hitting on exactly why we're frustrated here. why I was expressed frustration, why our board's frustrated, expressed frustration last week, why our Board of Supervisors is frustrated, why our public health team is frustrated. There are mixed messages. There are differences of opinion between the federal and the state on testing. But I will reiterate what it is we know today. The governor of the state of California is calling the shots on how this state and our counties are responding to COVID-19. And he recently published and announced his blueprint for a safer economy. He's made adjustments to that blueprint, which we've talked about, and he has added in a requirement for our county to test at the state average testing rate. State average testing rate is a little over 200. I think at last look it was 217. We're 150, 160. Because we are not testing at the state average, and again, that is a moving target, right? If everybody starts to test, that testing average goes up, and that's the new, the new benchmark, wherever that lands. Moving target, which we're also frustrated by. But he is holding us accountable, penalizing us by artificially increasing our overall case rate numbers because we're not testing at the state average. So we're confused. Doesn't make a lot of sense. We question the veracity of rolling in overall case rates as a testing rates, as a metric, and continues to be a source of our frustration, which is why our board is calling on the governor to make some changes and get it addressed.
Okay, thank you.
Just going back to Channel 29, Emily, any follow-up questions?
Yeah, so, okay, a couple things. So I just want to make it I want to be really clear that the county feels like our current daily new case rate is accurate, and that the state's inflation is not accurate of what is actually going on in the community. And is there any concern that if everybody starts to get tested, let's say multiple times, are there any concerns that maybe these testing sites might get overwhelmed?
So your first statement is absolutely correct. Your second question about concern regarding the capacity of our testing sites. Our testing sites currently have a considerable amount of capacity, and we have several of them throughout the county that are free, as well as all of the CVS locations and all of the urgent cares and those through your regular medical provider. And behind that, there was a lot of work done to make sure that we had the capacity to respond to increased testing back when those numbers were so high. So the concern is not the capacity, the concern is getting people out to get tested.
Got it. One more thing. Has there been any talk with the California Association of Counties about, I don't know, maybe some concerted effort on behalf of counties who feel trapped by some of these moving metrics to have a group effort to get the governor to, change some of these things?
Yes, there are ongoing conversations with CSAC from all of those counties who are affected by this, and those are typically represented at the Capitol by CSAC, and those will continue to happen.
Got it.
Okay, our next outlet, Channel 17, Eitan, did you have any follow-up questions?
Hey, Megan. Yes, just one follow-up for, I believe, Matt Constantine at the Board of Supervisors on Tuesday. And a week ago today, Mr. Constantine expressed some positive news, some good news, it seems, for our hospitals, ICU. Just checking in to see how that looks as of today, our hospital rates, and any updates with the school waivers. Thank you.
Yeah, we'll have Matt respond. Thanks, Eitan.
Eitan, yes, so the numbers do change on a daily basis. This is as of September 15th. Our available beds collectively with all of our 10 acute care hospitals is 906. We have 50 available ICU beds collectively. We have 69 COVID hospitalized individuals and 17 ICU COVID hospitalized. So our numbers, although they vary day to day a little bit, they continue to trend down. Our hospitals are healthy. The curve that we were worried about, that Ryan has spoken about earlier, continues to flatten. We've been doing a good job at making sure those hospitals remain available for those that are most ill. And we are hopeful that they will continue to trend downward so that we can potentially address any increase in the future. Does that address your question?
Indeed, it does. Thank you. And any chance that you have an update on school waivers? I believe last week you said that at least 15. I don't want to misquote you or anything, but any update on that?
Yes, sir. You're correct. I believe we're up to 17 schools. They do update on our website and on the state's website with more information as those are approved by the county and the state. So that is always the most current information. We do have additional applications coming in. It's an iterative process, so it's always changing, but there continues to be increase from local schools on trying to achieve that waiver. And so far, those that have been submitted and reviewed by us have all been subsequently approved by the state.
All right. Thanks so much.
Our next outlet is KUZZ. Rob, did you have any follow-up questions? Okay, the Bakersfield Californian. Sam, any follow-up questions? And then we have an unknown number on the line.